Côte Saint-Luc is a small but mighty city situated on the island of Montreal. Our city is home to over 32,500 residents and boasts the highest population of seniors per capita in all of Quebec. In the past year and a half, along with the rest of the world, everyone in our city has been affected by the catastrophic global health crisis of COVID-19. We are grateful to our frontline workers, our residents, our dedicated staff and public servants who did their part and faced this tragedy head-on. In this series, we'll meet the city directors who had to adapt under almost impossible circumstances and guide us through a crisis that has evolved into the most challenging period of time Côte Saint-Luc has ever faced. Hello, I'm Mitchell Brownstein, Mayor of Côte Saint-Luc. During the early days of the pandemic, each of us was put to the test. And for those of us who work in public service, the challenges seem to shift day by day, hour by hour, and sometimes minute by minute.
So at the beginning, we felt our role was to help the public health authorities spread information about what to do. One hand, what are we doing about our facilities? But secondly, we're also a public institution who's responsible for public stuff, and we have to tell the public how to be safe.
So we have to really have the sense of confidence that even if we don't know what we're doing, we at least have enough knowledge of how to make things work. There were a lot of logistics. HR had a lot of logistics to deal with. Dealing with masks, sanitizer, because they didn't know. Everything was wash the surfaces, right? Order plexiglass. Try getting plexiglass in June of 2020. Impossible to find any PPE, impossible to find all sorts of things. We had blue collars who had to clean the city and mow the grass and do the job. So we were on light crews. It was extremely intense in the first few months, extremely intense.
The largest challenge I had was trying to figure out what was best for the department, the people, the human capital. It was important that I give them as much information as possible, or clear information, and to make sure that nobody panics. Panic turns into rumors, and rumors turn into worse stories, and then people take action that is not always appropriate. So my biggest challenge was to keep everyone calm.
We got some support from the Employee Assistance Program. Staff here have that as help as well, to guide them, to have them be able to call them if ever they had some anxiety or panic attacks.
During the first wave, I was one of those exceptional people who was physically at the office every single day. There definitely needed to be some or a few people monitoring City Hall from a staff point of view, and allowing our staff to have someone on site to go to if there were any extraneous problems.
So in that first week, the most important thing was the technology, making sure that everybody had what they needed to be able to do their job from home. IT and finance were deemed essential services, so we always stayed. Once that was done, it was how are we going to service the residents when they cannot come to City Hall, because City Hall was locked down.
We realized that for most of our employees in public affairs and communications, we can work from home without very much disruption. And so the shift from working at the office to working at home was easy, and that was that's something that I'm proud of, because I think our staff adapted very, very quickly and very easily to that difficult situation.
All of a sudden, we were cut off from the community, and we had to readapt ourselves to become a virtual department, or a department that focused on people in a different way. So this was a very real challenge for us.
So normally the residents would come to City Hall if they need anything. So we issue permits, they pay taxes, they pay their parking infractions and so on. But in this case, because we were shut down, we decided to do a lot of things online. So we created permit applications online so people could pay from their home without having to come to City Hall at all. And that was something brand new for us. We weren't doing e-transfer before, so it was kind of an exciting way of doing it, well, and making it easier for the resident on their side.
You know, the seniors were a huge concern for Côte Saint-Luc in general, and so we focused on the seniors at that time, isolated seniors. We were reaching out to, I think at the peak, over 500 people a day, just to check in on them to see if they were okay, because the first wave really dealt with panic and fear and the unknown, which is what we were all afraid of.
All the directors would meet every day. I think it was 9 o'clock for an hour with the mayor as well, and any council member who wanted to attend as well. And you know, everybody came from a different vantage point of, you know, protecting the residents, protecting the employees, making sure that we were following the law, making sure nobody gets sick. So it was everybody played an enormous role in it. A lot of pressure on each of the directors, I have to say, and everybody really rose to the occasion, I have to say.
So we needed to adapt to provide services to the residents. And one of the first things that the library really sort of got on and needed to get on is what kind of services that the residents needed. They didn't need traditional services. They didn't need books and stuff like that. What they really needed was information. What they really needed was information, access to food, access to, like, how do I get my groceries now that I can't leave my house? So there was a lot of collaboration, and really food was the first priority. Once we got that sorted out for people and sort of helped them, and meanwhile, all sorts of other things were going on. There was the volunteer food program, grocery program in Côte Saint-Luc. The city partnered with the NDG Food Depot in order to make sure that we could help deliver food baskets to really needy families.
And our responsibility was processing the payments. So we had an agreement with IGA. We would pay the invoices directly to IGA, and then we would collect the money from the different residents through credit cards or checks. So we processed actually about 1,650, roughly that, of credit card transactions for this program that lasted about 2.5 months. And overall, I think we spent $170,000. So it was a big initiative on behalf of the city.
J'appelle des personnes en bonne santé de 20, 30 ou même 40 ans de se porter volontaire dès maintenant. Il y a des bénévoles dans des magasins qui remplissent les commandes d'épicerie pour aider à faire parvenir la nourriture à vous et à moi. Il y a ceux qui posent des gestes de gentillesse tout autour de nous, souvent en privé et sans fanfare.
Côte Saint-Luc was actually one of the first in Canada to put a mask mandate in place. And I do remember the whole discussion at the council level, you know, like should we not, should we wait for the government to do it and so on. And at that point they said, no, let's just do it.
As soon as Côte Saint-Luc realized the importance of mask wearing in preventing the pandemic, it really it literally took the law into its own hands and said, we need to protect our residents and we need to look at how we can save our residents' lives.
The mayor was very concerned about the welfare of our residents, and the first thing that he wanted was order masks, as many masks, and we will dispatch them to every resident. And I have to say, our team really rose to the occasion, and we did it. We got it done, and then we created a mask bylaw.
We got a shipment. We got 40,000 masks shipped to us from the CCMU. Great, because they were hard to come by. You can just go to the pharmacy and buy them, and they're like, go distribute. Go distribute 40,000 masks to residents. It's not very obvious how to do that. So my assistant, whose name is Tammy, she was, I'll call it mask woman. She literally got all the shipments of the masks and in her house, bagged them up, stuck a sticker. We had the distribution she organized with the building owners, and we had public security drop off many. I dropped off many, she dropped off many. We arranged it, they got it, and they distributed them inside the buildings. So we managed to literally distribute 40,000 masks in chunks to these people.
Certaines des décisions importantes qu'on a prises, par exemple celle du masque, là, étaient au tout début un petit peu controversée, bien qu'aujourd'hui ça fasse totalement de sens. On était les premiers au Canada à obliger le port du masque dans les lieux publics intérieurs, ainsi que certaines autres règles là, comme l'affichage obligatoire, le puérel obligatoire dans les lieux communs et dans les commerces. Au début, c'était très controversé puisqu'il y avait des positions qui étaient autres ou qui n'étaient pas encore prises par la santé publique régionale ou provinciale qui doutaient de l'efficacité de ces mesures-là. Donc, par exemple, le Dr Horacio Arruda, lui, n'était pas certain à ce moment-là que c'était la bonne chose à faire. Donc, de prendre la décision rapidement, nous, de le faire, c'était difficile. On croyait vraiment que c'était la bonne. On a fait nos recherches ailleurs. Donc, on était les premiers au Canada. Et heureusement, peu de temps après, là, on a été suivis par le reste de la province du Québec.
I think that's what really helped because Côte Saint-Luc had one of the highest numbers at the very beginning. So the mask, wearing of the mask was something that was very important to bring the numbers down.
Masks like this one will be mandatory in public spaces here in Côte Saint-Luc as of July 1st, after City Council adopted a bylaw in hopes to stop the spread of COVID-19 in the hard-hit area.
Without wearing masks, particularly indoors, the virus spreads. All the studies show that it spreads indoors. There's not proper ventilation. You don't have that wind blowing the particles away.
This is why Côte Saint-Luc City Council moved towards enforcing mandatory masks for residents and visitors shopping in the area come next month. Côte Saint-Luc has been one of the hardest hit boroughs on the island of Montreal, now with almost 500 confirmed cases and at least 34 deaths.
We moved on more to sort of how to keep people busy, how to keep people connected, how to keep people really sort of feeling a little bit normal. But of course it's Côte Saint-Luc and so many seniors are here and so many didn't have access to internet. So we had to come up with a plan. And so we really developed, created, and implemented this telephone broadcast system, which really moved where it's just calling a number on your telephone and where you could listen to things that you always used to do in person. So you could listen to Joe Schwartz, you can listen to to Hershey Dwoskin. You have access to really all the programs that we've always done before. All the librarians also, we started creating our own programs.
My second biggest challenge was making sure that the residents did not feel any kind of transition going into the pandemic. I wanted them to feel like they were okay at home. They were sequestered to their homes. They were not allowed to move. They were only allowed to look out the window. I wanted them to feel safe and that Public Works and Côte Saint-Luc was taking care of them and they didn't have to panic about their services and their health and welfare from the outside and from the city.
So customer service is not something that you can script. It's something that you feel, and it's something that we try and offer the community our genuine feelings in terms of what we do. So all of the programming and all of the teams and the sports and the facilities that we offer, we tend to them, with as much care as if it were our own family. In a couple of weeks, we were able to initiate some online programming and basically transfer all of our fitness programming on land. We were able to transfer it online, which was a real accomplishment, and I think we were probably one of the first departments on the island to launch all of its fitness programming online for free for the public to enjoy, because the goal at the time was just to keep that connection alive with the residents. And the real fear at the beginning was that we lost that connection. And how were we going to figure out a way to get it back or to reinvent it from what we had known it to be?
I've spoken directly with emergency physicians at the Jewish General Hospital. They told me that at the start of the pandemic, our residents took up a large percentage of emergency beds. Today, our residents represent a small minority. Whatever we've been doing is working. I'm absolutely certain that we will look back on these days and be thankful for all we did to help save each other. On behalf of our City Council and staff, be well and stay safe.